Erectile dysfunction. That's what we're talking about today. Welcome to Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Wiening.
And I'm Dr. Richard Casey.
Dr. Casey, thank you very much for joining us.
You're welcome.
Today, Dr. Casey is a urologist at our hospital. He's also the CEO of a research company, CMX. Check out their website. And he's here to talk about erectile dysfunction, which is an important topic to talk about because, you know, it's something that people might feel uncomfortable about. You might not bring it up to your doctor.
And it's pretty prevalent too. About 50% of all men over the age of 60 have ED.
50?
50.
Wow.
Okay, so
erectile dysfunction. So someone's having symptoms. What are going to be the symptoms? How do we define exactly what erectile dysfunction is?
Well, erectile dysfunction is the inability to obtain or maintain an erection sufficient for sexual activity.
Okay.
And most of the patients come in with some difficulty on that gradient. Either they have difficulty getting an erection at all, or they lose an erection while they're having sex with their partner.
Okay. So there's your main symptoms: obtaining and maintaining.
Yeah, that's right.
That's a symptom. So if you're worried about it, it's okay to talk about it with your physician.
Yeah, I mean, it's very common. It happens, while 50% of men over 50 have difficulties, men of all ages will have difficulties. And in general, about 1 in 5 or 6 times, most men will have an episode where they're having some difficulty or it isn't as good as they remember.
Sure. Okay. So someone has these symptoms. They go to their family doctor. Is the family doctor going to talk to them and treat them, or are they going to send them on to someone that's an expert like you?
It depends on your family doctor. A lot of men equate testosterone with ED, and the two are rarely related.
Right.
But so they go to the family doctor. The family doctor will check their drug history, but most of the time, family doctors, certainly in Canada, will refer patients to a healthcare specialist who has an interest in ED.
Okay, so here you are. You get referred a patient, comes in. We've talked about the symptoms that they have, the inability to obtain and maintain the erection. And now, what happens when they come and see you?
You get a proper sexual history. You want to know what his sex life was before he had difficulties. Does he have a partner? What does his partner say about it? Because you know the best person to talk about if a guy's having sexual issues is to talk to his partner, because his partner experiences it and often knows a lot about what might be causing it than you think.
You pointed at me there, then Brad. We're partners in the office. I just wanted to clarify.
I make no assumptions.
Okay.
That's right. We are both happily.
Yeah. So you get a good sexual history, and then you look at their drug history. Are they taking medications? The big one is antidepressants. Right. I mean, I think there's antidepressants in the drinking water in this town, but a lot of men are on it, and they have significant issues with ED from the antidepressants. Right. And you look at their usually their cardiac history. Are they have stents? Have they had angina? Or are they being treated for heart disease? These things are helpful. They're going to help us direct therapy. So we want to get a clear idea. But again, there's always a big psychogenic or psychological component. Because imagine if you've had difficulty getting an erection, for whatever reason, the next time you approach your partner, you're going to be anxious and nervous.
Okay. So I was reading, not for self-diagnosis, but for preparation for this video.
Sure, Paul. I know.
Well, I mean, judging by your 50% over 50 or 60.
1, 2, 3.
I'm getting there.
One of us.
Flip a coin. Flip a coin.
And it ain't me.
All right. And I was reading that ED is a risk factor associated with things like cardiovascular disease, cerebrovascular disease, even mortality.
About 50% of guys who present to the emergency room with a cardiac event will have developed ED within 2 years prior to that event. So what I tell young men, and often we see guys, when I say young men are 50 years old, 50 to 60.
Thank you very much.
Thank you, welcome. If they present to the family doctor with ED, that their doctor should think of their cardiac risk factors and evaluate them appropriately.
See, that alone is something that should make you think that this is something that should be talked about more. If it does have association with things that can affect your lifespan.
And the reason that he's saying that is because the blood vessels that feed your heart, that lead to a heart attack or a stroke, are the same types of vessels that feed your penis.
The penis is a little bit smaller. Sorry, not the penis, but the penile vessels are a little bit smaller. So it tends to be about a couple of years before that.
Right. So it's an earlier it's a warning sign.
Yeah, we like to think of the good point. The penis is an early warning system for the heart.
Okay.
Or a general barometer for your health. Think about it. If I had to ask a patient one question to find out what their general health was like, without knowing anything else about them, I say, what's your sex life like? If they have a good sex life, then we know emotionally they're probably intact because they're able to have sex with someone. And their vascular system's in good shape because they're getting good erections and are able to perform that
Their
way.
exercise tolerance is probably okay.
Probably okay.
Yeah.
So penis is a warning system for the heart.
Exactly.
We mean that physiologically, not romantically, as some people might think.
Okay.
Okay. So now someone's in your office, and what's the discussion?
Well, the discussion is you do a cursory examination to see, because some men will have abnormalities of their penis, Peyronie's disease, which is a fairly common condition where they get penile angulation. Usually that comes up in the history. So after a cursory examination, the discussion is, can we change your lifestyle now to help you? But I'm not going to make a patient wait for 3 years and start exercising and drop 20 pounds and stop smoking before we treat them. So generally, if their interest in sex is good, we would go to what's called a PD5 inhibitor, something like Viagra or Cialis or Levitra. So drug therapy is fairly quick with these patients.
Okay. And now, so just quickly back to the lifestyle. I think the important one you talked about is smoking. So smoking is a direct cause of erectile dysfunction.
100%. I mean, when I first started practicing, everybody was smoking. ED was much more difficult to treat because these patients had significant vascular disease. Now we see less patients smoking, but a lot of people are closet smokers.
Sure.
So I tell them
fire hazard.
I tell them to stop smoking, and unfortunately, as we all know, most men won't stop smoking, so we have to work around it.
Okay.
Don't give up.
Don't give
Our
up.
whole channel's based on lifestyle.
Everybody likes a quitter. Okay, so you talked about these medications. So you've now made the diagnosis. You've talked to them about the treatment. So how does the treatment work? Is it a pill? Is it an injection?
So the treatment is the mainstay of treatment, or what's called the PDE5 inhibitors. That's an enzyme that these drug inhibitors inhibits that allow the body to make more nitric oxide. And nitric oxide is the vasodilator of our system. But the conversation usually goes, I'm going to give you a prescription for some medications, and what do you think the first question the guy asks me?
When do I take it?
Yeah, what do you think?
What are the side effects?
How much does it cost?
Only in Canada.
And I usually say to them, would you go home and ask your partner, and tell your partner that that's the first question you ask me? Because
sure.
I tell them, what's more expensive than not paying for Viagra? I mean, men are very cost conscious, and probably 1 in 5 guys will not take the drug because of the $8 a pill.
$8. Okay, so in Canada, approximately $8.
Cheaper than a movie in Canada.
And then when we take it, are you taking it every day? Or are you taking it only at specific times? Or how does it work?
So generally, you take it in anticipation of sexual activity, and that's different depending on what age you are. Most men who've been married for say 10 or 15 years know exactly when they're going to be sexual, or they have a good idea, And so I say take it when you know. If it's within 2 or 3 hours, take it immediately.
Okay.
Don't try to time it just before. And again, back to the cost issue. Men are concerned they might take a pill and not get to use it, and they've wasted $8, but that's life. So you take it in anticipation of sexual activity, usually on an empty stomach, but it doesn't make a big difference.
Okay.
And you can take it every day. You can take it once a week. It works the same whether you take it.
Okay.
Now, Cialis, which is another one of the drugs like Viagra, has a longer half-life, so it stays in your system longer. So that's usually for the younger patient who may be either more sexual and maybe anticipating sex on Friday night and then Saturday afternoon. Remember those days? Okay. And so they would take it. And there's some flexibility with it. And the third way, you can take a daily dose of a low dose of Cialis, like a blood pressure pill. You take it every day.
Right.
And I like that for diabetic men or men who have significant vascular disease because you get better erections when you're sleeping, so it helps maintain the blood flow to the penis and heal some of the vascular damage that's occurred over the 30 or 40 years.
Okay, and on the $8 a pill, $8 a pill, don't focus on that price. It's probably different depending on where you live, but just suffice to say, the point is there's a cost associated with the medication.
And there's a big cost associated with not taking the medication.
Okay, there you
Of
go.
course. Okay, so now guaranteed, if you have experience with these kinds of medications, please leave some comments down below. Because guaranteed, someone's going to ask, if I take it, am I going to get an erection? Like, what if I take it and then I have to go out now, got to go get groceries now? Am I going to get an erection?
No, you might, depending on what aisle you're in the grocery store. But no,
That happens to you anyway. Especially in the vegetable aisle. This guy is plant-based, right?
When I'm back at the meats, I'm there. Okay, but no,
the kale away from
all it does is enhance the body's natural response, so you don't get unwanted erections.
Okay.
You rarely. I've never seen a man with a prolonged erection from one of these pills, so they're safe. And they don't change your behavior, and you really don't feel much different when you take it.
Just a little tidbit, and the history of that medication was originally like a blood pressure medication or something, wasn't it?
Yeah, the story goes is that they were doing a phase 1 study with these class of drugs, and they were giving male volunteers injections, and when the nurse gave the injections, the men were laying on their back, and when she came back to check their blood pressures, they were all laying on their stomach.
Okay.
And she noticed that they were getting great erections. And
Is that a true story?
I don't know.
That sounds amazing.
But it sounds like a fun.
And it seems like it would help the heart. Is there any evidence to say that there are secondary beneficial effects?
100%. It's used for pulmonary hypertension in kids,
Right.
and it is a general vasodilator. So, and I think they initially were developing it as an anti-anginal agent.
Okay, right. Okay, that's a little fun fact for you about.
So, but these pills don't work on everybody. About 70% of men that we see with ED will respond to these pills.
Okay.
You have to help them with their expectations, because one of the reasons for failure is they think, I'm going to take it and I'm going to have a great erection, long life's going to be great again,
Right.
And that's not often the case. So once you set their expectations that it's going to work most of the time, they need to be relaxed, they need to try it a few times, then most of the time it will work. But if it doesn't, there are other options for the patient.
Okay, other options. Let's go. So this isn't working. Okay, so you've tried, that's sort of your first line. Lifestyle modification, of course, in conjunction with pharmacotherapy.
Wait a second, before we go to other ones, any side effects? Anything, any downsides? We always talk about medications and their side effects, there are other downsides.
You tend to get stuff, because it's the vasodilator, you get a stuffy nasal passage.
Okay.
You can get a bit of flush in your face.
Headaches?
Headaches too, and you get the feeling that your heart is pounding. Usually those side effects go away and they're not dangerous.
Okay, important. Okay, so now.
And a bit of indigestion sometimes.
Okay.
All right, so you tried the medication. Either you had a side effect, so you could no longer take it, or it just didn't work. You're one of those 30% where it didn't work for you. What's the next line of treatment?
Next line of treatment, there are injectables that you can use. They're vasodilators again, and you prostaglandin, phentolamine. These are blood pressure medications that are used in the ICU. In the appropriate dose that we have pharmacies mix up for us, you can inject the dose in the side of the penis and get a great erection for 45 minutes.
Okay. All right. So we've got still kind of pharmacotherapy. It's an oral pill, injectable.
Yeah, pharmacotherapy. Then there
You
are
inject it right into the penis.
right in the side of the penis. I've never met anyone say that's a great idea. Let me do that right
Sounds
away.
like a horrible idea.
But I can tell you, once men do it and it works, it's great because they get a good erection most of the time that lasts for 45 minutes. I don't know what they need 45 minutes for, but it lasts for 45
Yeah.
minutes.
Okay. So all right. You do what you got to do.
Yeah, and there's a bunch of different doses available. So usually we can find a dose that fits with the patient. But again, a smaller percentage of those guys, it will not work, and you have to move on to more aggressive therapy.
Okay.
Quick question about it. What about the people that have erectile dysfunction secondary to like prostate surgery or consequences of having advanced prostate pathology? Is this something that is an option for them or not really because it's so different?
No. It's most of the men who have ED secondary to pelvic surgery or cancer surgery or radiation. It's a neurologic issue because the nerves are damaged from the surgery. About half of them will respond to the oral agent, so it's not a complete loss. And it really depends on how active they were before.
Sure.
If they had a good vigorous sex life before, they're going to have a good vigorous sex life after.
Okay.
But this is an important group, and I see a lot of these patients. And you can imagine a man has prostate surgery. He's now has erectile dysfunction. Usually they're incontinent at the same time.
Okay.
So he becomes a bit of a hermit. He withdraws from his friends. He withdraws from his partner.
Sure.
And I often get speaking at support groups, I have the female partners come by and say, what do you have for me? Because I'm living with a guy who doesn't touch me any longer. So it's a problem. But these injections work really well for men who have cancer surgery and have ED.
Pelvic fracture too, which is an overlap with our field. Pelvic fracture can lead to it as well.
Sure can.
Okay, so you've got the pharmacotherapy, the lifestyle pharmacotherapy, both oral, injectable. And got anything else? If that doesn't work, if someone
Okay.
does not want, is it compliant with that?
So there are external devices that the vacuum pumps, and essentially it's a cylinder that you put over your penis, and you draw venous blood into the penis and put a ring on the base of it. It sounds grotesque when a young man hears it, but older men like it, and it can produce an erection sufficient for sexual activity. And so vacuum, it's
I think
called a
Austin
vacuum.
Powers joked about that in one of his videos, right?
Yeah, but if you search the web, most of these devices are wink wink trying to tell you that it's going to make your penis longer, and it really doesn't do that. It will give you an erection. And then imagine if you're 85 years old, you just want the erection up as a sign that you're interested, not really use it. But vacuum pumps
Like
work
a flag.
like a flag. Hey, I'm ready. Okay.
Right.
And then there are penile implants, which is a surgical solution that are good for all ages depending on their pathology.
Okay, and obviously with the inherent risks and benefits of any surgical procedure.
Yeah, I mean, the problem with penile implants are they give you a good erection, but most men are not as happy with it as they expect because they imagine their penis always being a bit bigger, always being a bit wider. And so while we do a lot of implants, the satisfaction rate is not nearly 100%.
Okay.
Oh boy. Okay, so there you have it. Erectile dysfunction. Hopefully we've normalized it to a certain degree that you feel more comfortable talking about it. If you're suffering from it, if you're over 50 or 60, there's a 50% chance you are. Talked about lifestyle, pharmacotherapy, both oral and injectable devices, and surgical implantation. What more do you want from us?
I don't know, that's all we got, I think.
That's plenty.
That is plenty. That's an amazing summary. Thank you, Dr. Casey, for educating us. And if you guys like this video, please like it, subscribe to our channel, leave some comments about your experience down below.
It's funny that this video is way longer than our blood pressure or other life-threatening condition videos.
Cancer.
Well, because it's more important. That's why.
Coming from a urologist. Thank you very much. Thank you for everything you do. And remember, you are in charge of your own health.